Okay, so welcome again to the Spring Open House. The paramedic programs are within the School of Allied Health. And I am the Associate Dean for the School of Allied Health. Carolyn Treemstra is the Dean for our division, Community and Health Studies division, and Terry Morbido is the admin assistant to our school. So that if you ever see communication, it will be from one of us. Okay, so so in the paramedic programs, we have two programs, as mentioned, the primary care paramedic program and the advanced care paramedic program. So the PCP program is the 2-year diploma program that you will be participating in both a didactic portion, so a theory portion, and of course labs and prac as well, so placement experiences. In our theory classes, they're quite heavy. We'll go over some of the courses that you will be engaged in. And our labs are all hands-on. Something that you may not be aware of is that we have been on campus for labs since last September. So the current students have been engaged in all of their labs. They're taking their theory courses virtually. So those are being delivered online in both a synchronous and an asynchronous. So sometimes the students are on for a couple of hours or an hour with the professors, and then they have some asynchronous times as well, where the students are participating in other activities, assignments, online discussion boards and quizzes in their own time. And there are scheduled class times. So even though they're virtual, they're timetabled for synchronous delivery. And as I said, all of our labs have been delivered for all of our health programs in the School of Allied Health on campus. So with the COVID restrictions in place, students are currently wearing PPE and they're able to participate in their labs. Paramedic students have also been participating in their rideouts. So we've been very fortunate. So our term 4s are currently out, riding out in the ambulance and engaging in their consolidation placement. So our theory courses include such topics as anatomy, physiology, pathophysiology, patient assessment, patient care procedures, pharmacology, legislation, professionalism, and interprofessional education. The students are required to complete some physical requirements also in the paramedic program, and that happens in term 1 and 3. So there is a lifting assessment that students must meet. It is a vocational learning outcome that is mandated by the ministry. So students must complete that lifting assessment. So we encourage students right from the get-go, right even before they get on campus in September, to start working on those physical requirements. And we do talk about it on orientation day as well, so that students start getting into shape to make sure that they're meeting those lifting assessments. We also have a course called Ambulance Operations that Lindsay actually teaches. The students also participate in driving simulator. So we do have, that is also a vocational learning outcome that the students have experience, not driving an ambulance because we can't do that, but that they meet an outcome related to driving. So, and the ministry mandated requirements for operating a vehicle safely. So we have purchased in the last couple of years a driving simulator, and the students rotate through that training in one of our labs. Okay. I put the link up there to the actual paramedic program if you haven't already looked at it. That is on the Niagara College website. I won't go to it now, but we can refer to that as well. That lists all the courses in term 1. Oops, okay. The advanced care paramedic program is a postgraduate program for graduates who have successfully completed the primary care program, most of our students that return to take the ACP program are already working in the field, and then they're advancing their education, they're advancing in their profession to work at a higher level as an advanced care paramedic. And there's a set of exams that go with that at the end. That is a one-year program that has a two-day a week curriculum. So the students are on campus for their labs, and again, learning off campus virtually right now for their theory courses. The students are on campus for the fall term, and then in the winter they're on campus for 7 weeks, and then they start their clinicals. So they're heavily involved in a clinical placement at the hospital, and then they're off to a preceptorship later on in the spring, summer, at the end of their academic year. So it's quite very extensive. They're immersed in over 620 hours of hands-on practical work experience, heavy theory courses as well. And then upon completion of the program, they're eligible to write their MCA test exam, their provincial certification exam. Okay, so one thing that we like to stress right off, very early, because it sometimes gets away from students. When you receive your welcome letters in May, students that were accepted in the program will receive a welcome letter from the program, okay, with requirements for you as a student. So they're post-admission requirements that we need for the program. And for the paramedic programs, you don't need this day one when you come in September, but you will need it shortly after. So typically around mid-October. So we want to make sure that the students are aware and that we keep reminding them that they need this information. It's very, very important, because without this information, students are not able to participate in any placements, okay? So, and this is the same for all of our programs, with the exception that some of our health programs require it day one. So we try to remind the students as best we can to make sure that you read your welcome letter so that you're prepared for day one. Make sure you have everything that's required for day one when you start, because all of our programs, you jump right into labs. And again, for paramedics, so here are the requirements. Every program in the health field needs the CPR, healthcare provider C or BLS provider, the police check with a vulnerable sector screening, so with a VSS. And the police check sometimes can take several weeks, right? We've seen up to 12 weeks before a student is cleared, and that could really make or break you. So if you wait until October to start the process, you may not have all the documentation ready, receive it and submit it to the college for processing, and then you're held up, or you actually can't move forward and go on your ride-outs, okay? It is not the college that asks for this information, it is our placement agencies. So, and for paramedics, you must have a clear police check with a VSS, so very important. Your CPR, first aid, and then your CDS clearance, so your communicable disease screening clearance, and that must be filled out by your physician. And sometimes students will think that they're clear, but they may be missing a vaccination, they may be missing something, and then that will also hold them up. So we want to be clear, and we want to make sure that parents are prepared, or that students are prepared, and that you're aware that you need to get this done, right? Because that as well can take some time, and especially right now during COVID, doctors' offices may not have as many appointments. So we want to make sure that we have this information to you so that you know what you need. And again, it will all be sent out in the welcome letter. Uniforms are purchased for the students as part of the material fees. And we usually have a couple of dates where there are fittings for the year one, term one students. And then you get to try on or pick your pieces, and then the order is sent, and then the uniforms actually arrive on campus and they're distributed to the students. And then there's a couple of other things that you may need, like a stethoscope or a BP, a blood pressure cuff, that will also be required, that the program will let you know in your welcome letter exactly what it is, or during the first day of orientation. Okay. Other than that, other requirements that are listed on the course outlines, which are posted on the college website. If you go to the paramedic program and you click on any of the course links, for example, Emerge 1242, if you click on that, you will see the requirements for that course, right? So you'll see if you need a textbook. We do recommend that in term 2, the students purchase an iPad because we use an evaluation system that the team uses the global rating scale to evaluate students consistently, because that is the tool that is used out in with your base hospital training and other certifications and with the services. So we follow those same standards. And the platform that is used, the software that we use is called SimClar, and it is compatible with an iPad. So we do strongly recommend for the students to have an iPad starting in term 2. Okay, so if and when it comes to the time that you need your documentation submission, so your health clearance, we send that in your package so that you're aware, and then the placement coordinator goes over all of the requirements with the students, over and over again, to make sure that you're on the right track. And then there's a checklist that we provide with all your required information and an envelope so that you can submit the whole package at once, right? So that we don't have little pieces here and there. So this is sort of the checklist that you'll be provided to make sure that you have all of the information. Again, a copy of the standard first aid certificate, copy of the CPR, healthcare practitioner or BLS provider. They're the same thing. They just go by different names, but it should. I think now everyone's moving to BLS provider. Copy of your CDS clearance, and you do not submit your communicable disease clearance to the program. You submit it to the health center at the college, and then they check it off to make sure that, so the nurse and the healthcare professionals there will check it off to make sure that you have everything, that you're cleared. And then all they do is send you an email to say, yes, you're cleared. And then you will provide that to the placement coordinator to make sure that you're checked off, that you're cleared to go. Okay. And again, this is for our placement agencies, because you will be out on ride outs, right? And out in the community and out in the hospitals. So this is an absolute 100% must. And there's no way to get around this. Every student must be cleared. And the police. So your criminal reference check with a VSS, a vulnerable sector screening. Okay, so those are the requirements. So all of our programs at Niagara College are amazing. But what makes it unique? What makes NC's health programs unique? Obviously, we have amazing educators who are healthcare professionals, who are actively involved in their profession, working, for example, in paramedics. The educators are working still as paramedics. They're actively involved. They sit on committees and participate in their areas, in their profession, in their fields. The experiential learning is a huge part of your education. Your program, the paramedic program, is actively involved, not only in riding out on the ambulance, but also in community outreach programs. We are currently involved in a project with the homeless shelters. Students will be going out to assess the residents, the guests at the homeless shelters for with the diabetic foot clinic. So that's a huge project that we're currently starting up and involved in. We're also involved in sending the paramedic students out to the homeless shelters to do various tasks, meet with the vulnerable population, be involved out there. Our paramedic students go out to hospitals for emergency room rotations and IV starts. So that's in term 3. In term 2, you will be involved in like I said, the community outreach programs, and then blood pressure clinics on campus when activities is resumed to full capacity. Our ACPs are involved with the dental clinic, so they meet some of their competencies in the dental clinic. There's just so many other things. So definitely a busy, active program that you'll be involved with so much hands-on learning and real world experiences. When you're in the labs, definitely simulation and scenarios that you'll be involved in, learning how to use all the equipment right from term one and moving forward. Simulated sessions, scenarios, so client care clinics. So again, very, very active hands-on program. We also, in the School of Allied Health, really focus on interprofessional education. That's a big part because every healthcare profession out there works with other healthcare professionals, right? So we want to make sure that we learn about other professions and what they do, and that we appreciate how other professions fit into our patient care. So we integrate several health professions into the healthcare team, and we actually have a course that all of our students participate in. It's called Health 1020. It's an interprofessional education course, and you will be collaborating and working with students from the other healthcare professions, including nursing, PSW, pharmacy, OTA, PTA, and many of the other professions. So you get to learn about what they do and the importance of their roles, because as a paramedic, you will be working and collaborating and handing off patients to nurses and working with pharmacy. So it is a real team-based approach to problem solving and developing those essential skills, conflict management, communication, all of those skills that are needed for a well-rounded healthcare professional. Some of the other services obviously available at the college: academic advising. We have an academic advisor, Jody Thomas, who in the month of August has a startup session for students that will be coming in September with more information. And she also mentions the documentation piece over and over again to keep students on track. Jody Thomas is dedicated to our school, so academic advising is available to support students with their needs. Peer tutoring, accessibility services, financial aid, counseling, the SAC, the Student Administrative Council, library resources, and then the link to lockers so that you're prepared when you come on campus to rent a locker, to put your personal belongings in for when you're going into the lab. So all of the links are, the website is amazing. You can find anything in the search bar. You can, just type in anything and it'll take you to the services. So that brings us to the end of the formal presentation. So I'm wondering if you have some questions.
There's 3 questions. I can answer probably 2 of them.
Oh, perfect. Go ahead, Lindsay.
The only one I'll leave for someone else is if the acceptance packages are sent out, is it through email? I'm not sure if that's through email or through regular mail. That one I can't answer. I don't know if someone can answer that one.
Yeah, it should be through both, correct?
Both, yes. So you'll get an email and then you also get that package in the mail as well. It may just be delayed just because not everyone is working on campus, but you will still receive that package in the mail for sure.
Perfect. Okay, the second question has to do with the lifting. So Karen wants to know the requirements pertaining to lifting and fitness. So for year 1, you are required at the end of term 1 to be able to lift with a partner, lift and carry 150 pounds. That we have a weighted mannequins that we use for those assessments. And then by the end of term 3, so second year term 3, you are required to lift and carry with a partner 210 pounds. So there is quite an extensive lifting component with this. So that's why it is recommended that you start on that physical fitness pretty much right away and don't just leave it to the last minute, because obviously, gaining your strength doesn't come overnight. And then Kyra, what are the class sizes? So we take 56, I believe. That is
Yeah,
still
correct.
correct. So 56 students every year accepted. So we start with 56 and then sometimes that changes, but we start with 56. So how many applications come in there? It used to be close to 700. I don't know if that's changed, Eva, if you can, but I know.
Yeah, we had over 600, I believe, between the high 500s to 600 this year.
Yeah, very.
With a wait list. There is a wait list.
The cardio requirements, I think that would be, there are some other in your gym classes, there are some more physical components when it comes to their classes. I can't really speak to what's the requirement for that as much because it's not our classes, but there is a physical fitness, kind of more general physical fitness rather than just strength lifting when it comes to your phys ed classes. There are cardio and everything involved in that. And then even when you go to get hired, we try to make our physical fitness testing in our program related to the physical fitness testing that you have to compete or to do in order to get a job. So there's a physical component of hiring, and that is a cardio component, a physical fitness test and endurance. So that's why we try to kind of make our training very similar to what you'd have to do to get a job.
What are some of the areas students struggle with most during the program, Lindsay, in your opinion?
Two different ones. One is, again, the physical, the strength. And then I think the other one is just your time management. There's a lot of information in a short period of time. And you have to make sure that you're dedicated and are able to kind of handle a lot of things at once and ask questions when you need to ask questions and try not to get too far behind. And if you are struggling, reach out so we can help you. But there's a lot of information that kind of just gets stacked on top of each other very quickly. So if you are good with your time management and can handle that and have a good plan and are dedicated to your studies, then it shouldn't be an issue.
Yeah, for example, there's a course in the first term that Lindsay teaches. It's the theory class, which is an 8-hour class, and it's a heavy course. So but it is the foundation, right? It is the foundation of anatomy and physiology, and then it moves into the pathos. So it's very very important. So you want to stay on top of that because you need that foundational knowledge before you can move. And everything is linked. So what you learn in Lindsay's class, you would carry over to your labs. So it's very important to stay on that. So yes, absolutely time management to stay on top of your courses and the workload. How are classes? So yes, you could have a class any day of the week, 5 days a week. You'll have theory classes, your gym, as Lindsay mentioned, your gym class, your phys ed class, and then your labs. Yes, pretty much 5 days a week. And then when you start your placement, in term 2 with some of the community placements, and then in term 3 with the hospital, and then with the ride outs after that, you could be on placement anytime. So they are 12-hour, you will be following your crew. So you could be out weekends, nights. So we have, as you move up to the upper levels, we have days blocked off for your prac, but then students get to choose their schedules under the supervision of the program and in collaboration, obviously, with the emergency services, the EMS services, whether that's Niagara EMS or some of the others. And then students must follow that schedule because if their crew's working, then they're working. Anything do you want to add to that, Lindsay? Did I miss anything?
No, I think if when the students talk about it, I think first term is not as compact, and they can sometimes, work through school, family, working. But as the terms continue, so term 2, term 3, term 4, it gets busier, and there's more of a dedication to school. So again, it all comes down to time management and realizing, what you have to do. And not everything, it's not just in school. In order to be successful in this program, you have to make sure that you're carving out some time after school to review stuff, to study, to, to go, do after hours labs, hopefully if they come back. But it's not just in class. It's a huge dedication, in my opinion, to be successful. But you can do it. It's done. It just takes time.
You buy your equipment through the school, the stethoscope, you can, but you can,
You don't have to.
you don't have to. Yeah, you can buy it wherever. Yeah.
I always recommend, if you're going to spend money on anything, if you plan on being in this career for a long time, to spend, like, you don't have to spend a lot of money on a stethoscope. A Littman, usually the entrance level Littmans are good, because this is a piece of equipment that you will use for your entire career. It's not a good stethoscope is not provided when you work, so it's your own personal stethoscope. So you'll use it in school, you use it in the ride outs, you'll use it when you get a job. So you don't have to get the best. I wouldn't get the best, but I wouldn't go to Shoppers Drug Mart, if that makes sense.
Yeah, and more information will be provided on that in your welcome letter and then on orientation day. So you don't need to worry about that
Yeah, you
ahead of
don't
time.
need it right away. Yeah, you don't
Yeah.
need it first day of school, that's for sure.
Yeah. Placement options come second term. Are options open to students, or are they predetermined? They are predetermined. We have agreements with our placement partners. So we do have rotations for students. So for example, if students are going through one of the sites that students were participating in was the Hope Center. Last year, obviously things were suspended due to COVID, but so yes, students go through a rotation. They're assigned so that everyone gets a similar experience. They might not be at the same site, but it is a very similar experience. So yes, they are predetermined and assigned to students. Do any students come straight out of high school?
Mhm.
They do, yes.
Yeah, every year I see a little bit more. I think there's quite a lot in this term, in year one right now, that are coming out of high school. It can be done, absolutely. If not, the other recommended pathways, if you don't feel you're quite ready coming out of high school, is our pre-health. A lot of our students take a year of pre-health first, and that gives them a good foundation prior to coming into the program as well. So that's another option. If you don't feel comfortable coming in right out of high school, take a year of pre-health and then apply.
What is the approximate pass rate for paramedic students on the MCA, at Niagara College? It's very high. It's between 95 and 100% of students pass their MCA. And you need a 70% to pass. And Lindsay actually teaches an MCA prep. We call it MCA prep, but it's a certification exam prep course in term 4 to help students prepare for that.
And throughout the whole year, we try to get students to achieve a 70% or higher in all courses, just so that, they're prepared for that at the end. So, whoops. So employment is actually good right now, in my opinion. We're at a stage right now in the workforce where we have a lot of people retiring, and within the next, I would say 2 to 5 years, we're going to have a significant amount of employees that have hit that 35-year mark. So they will be retiring, and anytime there's a huge, flux of people leaving, then obviously they have to do a lot of hiring. So currently right now, I think every service in the whole, not even Niagara region, but even, Toronto, Peel, Waterloo, Guelph, everywhere around right now, they're at least hiring minimum of 40 plus people for the summer. And there's even talks of additional hires in the fall. And I can see that continuing for a while again, like I said, because of our retirement rate of employees. He's going to have a lot of new hires. So it's good.
Yeah, I actually, you're right, Lindsay. And I heard the other day that Toronto had a posting for like 100 new recruits. They don't have enough, grads to fill all the openings.
Yeah, so it's a good time right now.
Oh,
Yeah,
an elective. Yeah, there'll be a list of electives that you can choose from. So there is like a list of gen eds that will be offered to you that you can choose from, and they change. There's everything from like the history of NHL to like psychology. Like it's a wide range. So there should be something that strikes your fancy.
Yeah, it's again, it has something, the whole point of electives is they have nothing really to do, not necessarily with your program. It's an additional course on top of that. So it's anything you would like.
Yeah.
So it's not one you have to pick, just pick something that interests you, something different.
Yeah. So how long are police checks valid for? So good question. We require them. And again, we meaning, we adhere to the guidelines and the rules of the services every year. Every year you will need, at the start of year 2, you will need to provide another police check. Okay. And if you get it, if you started in August or early September at the latest, so that we have it for that mid to end of October, because we have seen many students who end up with nothing. They actually can't move into term 2 to go to participate in their prac course because they don't have the documentation. And so, for example, Niagara EMS, we have a very strong partnership with Niagara EMS, and the superintendent comes on campus or meets with the students. Depending on the situation, will come on our campus or meet with the students because he has to verify the police checks. He's the one that has to actually feel for the seal and make sure that they're valid. And if the student does not have that at the orientation, because the Niagara EMS provides an orientation for our students before they head out to rideouts, of course. And if the student does not have that documentation ready, then that's it. There's no other option. They're not coming back again to check. So you have to have it done, I'm going to say by October 15th. It might be a little later than that, but the sooner you get it, so that they have it for when they need it. Okay, so please keep that in mind. And they are required to reproduce them every year. The police checks. And yours. Sorry. No, go ahead.
I was just gonna say, you may think that it won't be an issue because you don't have anything bad on a record check, but one of the problems that a lot of people have, and even as an employee, if your name is you have the same name as someone who does have a criminal record, then it has to be verified with fingerprints.
Yeah.
And that's what can take a long time. So it may be totally out of your control, but if your name comes up with someone else who does have a criminal record, you have to go in for fingerprints and they have to be sent away. So that's what can sometimes take quite a long time to get cleared on your record check.
Right, exactly. And you can imagine that, start of school, there's a backlog because every program, every post-secondary institution is waiting for clearances. So there would be a backlog. Can placements be done anywhere, or are they all in Niagara? So for the paramedic, the primary care paramedic program, our partners are Niagara EMS currently.
What can they do to ensure the 56 if during the place period is not good? I don't believe there's any, if someone can correct me if I'm wrong, but there is no preference if you didn't get accepted one year over the next years.
That's
I know
correct.
I've told students in the past, one of the things they do look at with the enrollment is your biology mark. And again, correct me if I'm wrong if this has changed, but it's your biology mark that they pull out separately from all your other marks. So it goes by marks, it goes by academics. And if it really goes by how high your biology mark is. So if you are trying to improve on something prior to being accepted, then work on that biology. And it doesn't matter if it's college, high school, university, they're all looked at the same. It's just your grade for your biology separately from all your other grades.
So paramedic students require the flu shot. That's on your list of your CDS list. So the paramedic students will require the flu shot 100%. COVID-19 vaccines, because it's still new, we're waiting for our students will actually be getting the vaccination through public health. It will be coming, but we're just in queue waiting. The nursing or the dental students have already received the opportunity for the vaccination. Our paramedic students are definitely high priority. And moving forward, I'm going to say that it will probably become a part of the CDS. But since it's all new, we're not there yet, but definitely the flu shot. the flu shot has been on, and that is a service requirement for everyone to have the flu shot. That's correct, right, Lindsay? It's a service.
Yes.
Yeah.
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 Oh, sorry,
So-
you're, yeah, I think there's some questions on the other chat. Is that what you're?
Yeah.
The one was exempt from courses that you took universities such as anatomy. When it comes to our core courses, there is no exceptions. I have had students in my classes in my year 1 anatomy class that have university degrees in neuroscience, and they still come into it. They can actually, I'll draw on them for, information in class, and we can use them as a resource, but it is still required to take those classes.
Yeah, everything is directly linked to the profession. And as we said, it's linked to the other courses in the labs. And the faculty will talk about medical directives as they're teaching anatomy or patho. So it's all so connected that the course outlines and the learning outcomes would not match up for a straight exemption. Yeah. Sorry, go ahead. Go ahead.
So I was going to say the electives, I think I was going to get you to answer that, because I think you can, right? Get exempted? From electives?
From elective classes from previous, sometimes you can, so that you would go through the transfer credit area, and they would work on that. But yeah, and often students, if they've had previous education, may be able to transfer over the communication. So that, again, you'd have to apply for and see if it's transferable, but that's about it. And accessibility, yes, you would apply through accessibility services, and they would manage accommodations for students with learning disabilities.
Would the fitness and gyms on campus be open in September? I know a lot of gyms are closed. That I don't know. That's a
update on that yet. You would probably get an update closer to when the fall term approaches, just because yes, we are expecting a little bit more activity on campus in the fall, but as of right now, we haven't made any concrete decisions. It will just be based upon as we move forward and get closer to that term itself.
Full-time course, no exceptions. Yeah, our
Yes.
our PCP paramedic program is a full-time course. Yeah.
Full-time.
There's some great questions coming in.
Yes.
Yeah.
Students clustered together in residence. I don't know about the residents. I do know, I have heard that the off-campus residents here in Niagara, there is one gentleman here that will try to match, if he has applicants from similar programs, he will try to match them together so that there are, a couple from the same program in his off student residence, but I'm not sure about the actual college residents.
With the college residents, if you don't know someone that's already coming to the college and you don't have a specific roommate that you want to be paired with, what will happen is residents will actually get you to fill out a questionnaire, kind of like a compatibility form, where you'll answer a whole bunch of questions, maybe like if you're a night person or a day person, because the last thing you want to do is like if you're a night person with a day person, then you may not get along too well. But you'll definitely fill out like the compatibility form, and then they'll try to match you up with someone that's kind of similar to you. But again, there's no guarantee or anything like that. And the paramedic program is at our Welland campus. Niagara Lake is a total different campus.
For the core classes, again, it can change. I think it's availability to room size, but so far, most of our classes are either days or afternoons. We don't have very many evenings, but again, I think that all kind of depends on availability of classrooms. Yes, am I right?
Right. Yeah, you're right. You're right. Yeah, we typically go anywhere from 8:30 to 6:30 p.m. That's sort of historically been the time. We're fortunate because, the paramedic labs are dedicated labs. Other programs don't use them. So it is a little bit easier to schedule, but then the other courses have to fit in as well. So sometimes that impacts, where the labs land. Yeah, typically we've been going from between 8:30 and 6:30 p.m., not really anything later, but you could potentially go from 8:30 till 8:30 at night. But yeah, it's mostly during the day.
Our theory classes are already obviously pre-scheduled. The ones you have options for, like your labs, there's different lab sections. So you can, depending on when you get in and pick your schedule, you can pick you know, 8:30 start, you can pick a 12:30 start. It just depends when you get in and pick those times. And the number of participants in our theory classes, it's usually the entire class. So if there's 56 students, or in the past, it's been all of them in theory. In labs, it's obviously smaller numbers. Right now we are a 7 or 5-to-1 ratio when it comes to students in labs.
How is public safety in Welland?
I'm not sure what it's a safe city.
Yeah.
I live in Welland. That's what you're asking. I'm not sure what the extent of that question would be.
Yeah, we haven't had safety concerns. The campus is very safe. If students are there, I mean, our hygiene students are there till 9:30 at night. And even in the winter months, you know, and if students don't ever feel safe walking out, they can definitely call security for the campus walkout. So all the safety mechanisms are in place for students and employees alike.
And even if right now you are on campus due to COVID, there are safety measures that are taking place. Only one entrance is open. You will need to present your student ID, check in. You'll actually be provided with like some protective equipment. There's sanitizers everywhere on campus. So definitely, if you ever feel uncomfortable or anything, you can always reach out to anyone on campus. They're there to help you. And again, campus security will walk you to your cars. There is actually an NC safety app that you can download, so you can use that as well. The entrance that's open is actually the entrance that Lindsay has up as her background. That is actually the main. That is actually the main entrance. So right where Allied Health is, right?
Right. So yeah, if you walk in there, you're in Allied Health. We all have to tap in with our IDs, employee IDs, student IDs. Students are required to complete the orientation prior to returning or coming onto campus. They do that once for the COVID information, COVID orientation. So we all participated in at least one orientation, and 2 as things changed, a second one that will continue. Then you know, employees, so all of us ask for request access to come on campus. Students' access is tied to their timetables, so that at any time for contact tracing, the college is aware of who is on campus and the numbers of you know, the actual number of people that are on campus. Public health visits the campus regularly and works with us to ensure that we are, you know, gold standard. We do run a fully operational dental clinic that we have been running, and clients have been on campus. So we definitely maintain those gold standards.
Sorry,
Awesome.
and I should mention, so if you're coming on campus, you will be asked to fill out that form each time you're visiting campus. So if you have classes 2 times a week on campus, you are required to fill that out each time you're on campus. So it doesn't mean you fill it out for 1 week and not the next. So each time, and also make sure you please take your student ID, because that is something that you will need when you're checking in.
And in lab, we have full PPE we're wearing, because we're obviously closer contact. We do have gowns, gloves, mask, and goggles. Currently is what is required for in lab. So, and everything gets wiped down, sanitized, clean after every use as well.
Orientation day for the program. So it's September, is it September the 8th, I think, or 7th this year? I can't remember which day we have. We will have each program has an orientation, you know, virtual orientation will take place. And all the program specific information will be provided that day, including any of the COVID related information that we need as things change between now and then. It will open in August. It's usually around the 7th that the students between the 7th and during that week. So it'll be on the website, and you will be notified in your letters when you can pick your timetables. So you can just log on and in your portal, your Niagara College portal, you'll be able to access that information as well for when you can choose your schedules.
And I just put the COVID update link in the chat there. So that way you guys can find all the updates up until COVID is gone. But you'll find all the updates on that website there.
Yeah, and please make sure you attend your orientation session, because we provide a lot of information that day. The program provides, tons of program specific information, and then you're right into it after orientation day. You start participating, so you want to make sure that you're up to speed on everything before you head on to campus. And if there's a question, that you think of after this session, please reach out. It's just my email is just elimac@niagaracollege.ca. Same with Lindsay, lpriorello@niagaracollege.ca. So, and you can search us as well on the website. So please feel free to email us if you have specific program questions. If I can't answer them, I'll pass it on to the program.
I'm just going to say thank you for spending your Saturday with us. We really appreciate it. And if you guys have any more questions, please feel free to email Eva, Lindsay, or even that NC General email, and then any one of us will definitely get back to you guys. So thank you.
Thank you. Thank you. Enjoy your day.
Thank you, everyone.
Thank you.